Supportive can include hospitalization for administration of vasopressor drugs, antimicrobial medications, and fluid replacement. Okay, now on to STIs. So they're infections, of course, that can be spread by sexual contact. And I know you guys have already gone through all this in MedSurg, but we'll just do a review. Some have other modes of transmission. Most effective choice of birth control and prevention of sexually transmitted diseases is to abstain from sex. So certain STIs have to be reported, like we're getting a much higher incidence of syphilis back again. They almost stopped doing syphilis testing for pregnant women, but we were seeing too much of it again. So we started really screening, and it's really interesting on what a comeback it's making. So we have to be careful about these things, and that's one of the reportable things. So the incidence of STIs has increased during the past few decades, and we have a lot more casual sex going on, things like that. So teaching STI prevention is important because some viruses, as we know, like herpes, HIV, all that kind of stuff, remains in the body for life and can include long-term complications. HPV, so human papillomavirus, is the most common viral STI, and we're going to go over that. And some can result in cervical cancer, so we better be careful about that. So it's important that all sexual contacts of the affected person, even those who are asymptomatic, be completely treated to eradicate the infection. So we need to know who the partners are also, and a lot of times the doctors will treat them too, so that it doesn't keep getting passed around. And again, condoms, we've always learned that condoms prevent sexually transmitted infections, but not always. So it may not protect the woman if the male's lesion is on the scrotum or inguinal folds, and it can take 3 to 6 months after infection to develop visible warts for HPV. So treatment includes for HPV, cryotherapy, laser vaporization, just other treatments that you can look at on page 265. And the CDC recommends that a vaccination be given to all males and females between the ages of 11 to 26 to prevent the most common strains of HPV, because there's more than 100 variations of the HPV strain. So they treat the most common ones. Okay. So again, STIs can be spread by contact with bodily fluids from mouth, genitalia, rectum, and blood. The problem with STIs during pregnancy, one of the ones I can think of is trichomonas, can cause spontaneous abortion. It can cause such irritability in there that it can cause the uterus to contract. So preterm birth, intrauterine growth restriction, prematurity, neonatal death, congenital infection, postpartum uterine infection, and we'll go over that. Okay, testing and treatments for STIs. This is an extra little slide that I just thought was interesting. Rapid tests are available for HIV and herpes simplex 2, chlamydia, gonorrhea. Serum blood tests are needed for syphilis, confirmation of a positive HIV. And treatments, of course, for HIV are antiretrovirals, herpes are antivirals like acyclovir and Valtrex, and syphilis is penicillin. All right. Types of sexually transmitted infections. We're moving on, we'll come back to the hepatitis, but we're moving on to table 11.1 on page 266. So candidiasis is yeast, and the issue with us for maternity purposes is it can infect the newborn at birth. So we have to be careful of that. Then trichomoniasis or trichomonas, and it doesn't cross the placenta, but can cause postpartum infection. And then bacterial vaginosis can be associated with preterm delivery. It's a normal inhabitant of the vagina, but it overgrows is what happens. Then chlamydia. It can cause conjunctivitis and pneumonia in a newborn if they're not treated, the mom, before the newborn delivers. Uninfected infection can ascend into the fallopian tubes, causing scarring, infertility, or ectopic pregnancy. And it can spread to the neonate's eyes by contact with infected vaginal secretions. And that's one of the reasons why I really, really encourage parents to let us give that antibiotic white ointment right after birth to help treat some of these things. Gonorrhea, if that gets in your eyes, a baby's eyes, it can cause blindness. So that's why we give the prophylactic eye care. And if it's untreated, gonorrhea, it can also result in pelvic inflammatory disease with tubal scarring. So you can have problems with fertility later on. And then here we are with the syphilis. And you can see the chancre, they call it, that pain, that sore that's on, usually it's on in the perineal area somewhere on the labia. It's transmitted across the placenta, and it causes congenital syphilis, stillbirth, or spontaneous abortion. Syphilis is huge for pregnant women. We test everybody for it. And they get tested during pregnancy and when they get admitted to the hospital. That's how serious it can be. Okay. Then herpes can cause spontaneous abortion, stillbirth. HSV-2 usually causes genital lesions. The first episode is usually the most uncomfortable. When I was in nursing school, I was just 19-year-old little nursing student, maybe 20, and I was at the hospital, and they gave me this 80-something-year-old patient that had a stroke, and they said, you need to go put a Zolite on her perineum. And I'm like, for one thing, I don't know what a Zolite is, and why, if she had a stroke, would I need to put it on her perineum? Well, come to find out, this poor lady, had aphasia. She could say a few garbled words. Well, I went in there with my little Zolite and looked, and she had her first outbreak in the hospital of herpes. It was this red, ulcerated, goopy mess down there, and the Zolite was supposed to dry it out. And I just remember having to put that light on her perineum, and as garbled as she was with her speech, she said, I could understand that she said, I'm so embarrassed. But think about that. When I think back all these years, she'd been in the hospital for quite some time. I was a brand new nurse, so I didn't really think about it that much at the time. But how did she get it when she'd been in the hospital for a few weeks? Her primary outbreak. That is just a horrible thing to think about. Okay, it's very painful, the primary outbreak. And then the HPV, you should see some of the growth we get. The growth may obstruct the birth canal. So seriously, these warts can not only cover the perineum, but they can grow inside the vagina. And what can happen is the baby's head comes down during delivery, they can be torn off. And it can cause bleeding, and it can cause laryngeal papillomas in the newborn. So that can be really wicked. Then getting rid of them is just, if you've got them that bad, can just be so major, because there's just so many of them. So it's good that there is a vaccine available if people want to get that. Okay. Then HIV. Problem with HIV is initially there's no symptoms. And so the pregnant woman might not know. So we do HIV testing during pregnancy and when they get admitted for labor if they want to be retested. If they've been, sexually active or promiscuous with more than one person, things like that. So we want to prevent breaks in skin of the mother and fetus during the birth process, because it can be transmitted to the newborn. And they usually recommend that the newborn, of course, be bottle fed. And we also do very close monitoring in pregnancy for any complications. So there's fungal and bacterial types of infections that we could deal with. Okay, hepatitis B is back on page 265. And you guys know what hepatitis B is. Inflammation of the liver from a virus can cause liver failure, can be transmitted sexually, IV drug abuse, or intimate contact with blood or body fluids. Symptoms are nonspecific: malaise, anorexia, nausea, fatigue. And immunizations are available for A and B. And there is also a cure for C now, I hear, which is incredible. Okay. HIV remains a worldwide health problem, and we are seeing more. Patient education plays a key role in prevention, quality of life, and compassionate, knowledgeable referral. At what point do we need to get further care for these people? Early diagnosis, access to care, medications, and safe sex practices are improving outcomes. It doesn't mean that we're not seeing HIV, but we're improving outcomes from it. HIV screening with pregnancy is essential. Again, many women don't know they have it, and sexual contact may have is one of the most common risk behaviors. Oops, I screwed up a word.